Hello, everybody, and happy Thursday Night Live. We're so excited to have you with us tonight. Our special speaker today, it is Dr. Noha Oushy. Introducing Dr. Oushy, a biological dentist who integrates oral health within the broader framework of whole body wellness. With advanced training in cranial osteopathy, I can't wait to talk to you. Airway health and multidisciplinary collaboration, she practices dentistry through the lens of structural harmony and systemic function. Her work emphasizes a powerful connection between the teeth, temporomandibular joints, cranial system, and overall physiology. I already have so many questions in my mind right now. Helping patients achieve not only optimal health, but also improved breathing, posture, and vitality. The topic today is biological dentists with special interest in airway health, cranial osteopathy, and total well-being. Thank you so much for being with us today. And I did ask her earlier, she is in New Mexico. So if you're looking for a biological / airway dentist over there, she is your girl. Welcome to the Airway Circle stage.
Thank you so much, Renata. It's so good to be here. Thank you for having me. I'm really excited to speak with you today and kind of share a little bit about how I practice dentistry and how it's kind of unique-ish because it kind of combines a lot of different loose ends and looks at the patient from a very, very different, broader lens. So thank you for having me. And yes, I am in New Mexico on the border with El Paso, Texas. So literally across the street is El Paso, Texas. So we do provide services to our patients who live in El Paso. And actually, we get a lot of patients that come from further Midland, Texas, from Arizona. So we provide service to all people from all sorts of
Yeah,
areas. So yeah,
this
excited
is
to be here.
This is amazing. Thank you so much. And as you start sharing your screen, I'm going to go live on Facebook for a little bit. We are live. If you're watching this live, you are an Airway Circle member. So thank you so much for supporting this Thursday Night Lives. We can only do this because of your support. And as a little reminder, if you're not on the Airway Circle directory yet, please join us. It is free for you to join. It's free for patients to try to find you. It is free for other professionals to try to find you so you guys can collaborate together. If you go on airwaycircle.com, click on directory, and then you're going to scroll down and you're just going to click on the add button and you can add all your information over there. Make sure you're logged out of your membership because those are two different softwares. But you can go ahead and share your screen. As another reminder, we have Foundations 3.0 starting January 1st. Our myofunctional therapy intro, but not really intro, is extremely comprehensive compared to anything else out there. Myofunctional therapy online course. So join us if you wish. We're going to put all the links in Airway Circle Professionals. If you're not in that Facebook group yet, please join us. It's also at no charge, something brought to you by the Airway Circle members. Thank you so much. The floor is yours.
Thank you so much. So just want to thank you for having me. I want to kind of shed some light on the importance of looking at the patient through a whole body lens and how we tie biological dentistry, cranial osteopathy with the dental well-being of our patients. So a little bit of background about myself. I am a biological dentist. I am certified by the International Academy of Biological Dentistry and Medicine. I am accredited with the International Academy of Oral Medicine and Toxicology. I dove kind of deep into cranial osteopathy, took multiple courses with the Cranial Academy. I completed my affiliateship with the Breathe Institute. So all of these multidisciplinary areas are what really excites me about, patient care and really helping change lives. So, little disclaimer here. This is only for educational purposes and not affiliated financially with any institution. So why biological dentistry? Biological dentistry is actually not a new specialty, and it's not a voodoo specialty. We practice legitimate, good quality dentistry, but our main goal is kind of like the pillar of biological dentistry, and any biological dentist will tell you that we always seek or try to seek the safest, least toxic ways to accomplish our mission. And we do that treading very lightly on the patient's biological terrain. So biological dentists tend to get the patients that have seen everybody. They've gone out there, they're not getting better. They have a lot of autoimmune problems. Their methylation pathways are affected, so they don't process things like someone who doesn't have any problem does. So they come to our offices with problems. So we don't want to add more issues to what they're already dealing with. That's because dentistry is toxic. Everything we use, is some kind of chemical. So we try, all biological dentists try to perform the goals of modern dentistry while keeping it to the least toxic way possible. So what does the initial assessment look like in a biological office? This could be very similar to other dental offices that do airway or TMJ or breathing. We take a very, very thorough medical dental childhood trauma birth history. This is all very important because birth history and childhood and trauma tells me what happened to that patient's cranium as they were developing. Did they fall when they were 2 on a bicycle? How did they fall? Where did they impact the floor? All of that guides me on how to best help my patients. We take CBCT scans. We assess the TMJ. I make sure every single scan we take is sent to a radiologist to read it and help me assess better. I've learned so much over the years just reading radiology reports from my radiologist and like educating myself on how to best help patients. He sometimes finds things in the brain, some things in the sphenoid bone. Like the other day, I had a patient that he saw a cyst / benign tumor in the right petrous part of her temporal bone. Why is that there? Is it related to some kind of trauma she had? Some osteomas that he finds. So, all of this really helps us dive deep and look at the big picture. We do a gait analysis. Why is it important for a dentist to watch a patient walk down the hall and back? Because things that we do in the mouth, whether you do a little filling, you pull a tooth out, you're putting strain and stress on the body, you're putting strain on the cranium, you're shifting things. Even a crown, just doing one filling or crown can throw off the cervical spine, can throw off things. Patient might have issues with their feet that's actually affecting their cervical spine, and we can't get them stable or balanced in their mouth if we don't look at the full picture. Now, I do gait analysis not because I'm wanting to be a podiatrist or a PT, so that I can know where to refer them and how to collaborate with other functional medicine doctors to best help our patients. Some of these patients need compatibility testing. They have all sorts of materials in their mouth, and you can see that their gums are reacting to these materials. So doing a compatibility testing to figure out what are they reacting to, again, helps reduce inflammation, optimize function. Why do we, as biological dentists, have to discuss nutrition? This is what a patient looks like who is deficient in vitamin D3, K2. So many of my patients, I ask, what's your D3 level? They don't know. If you guys look on literature, Dr. Joseph Mercola, vitamin D levels are crucial, and what is considered sufficient might not be enough for that specific patient. So this picture you see is not just deficiency of vitamin D3, K2. There's a lot of other mechanical issues going on, but we have to ask our patients about their vitamin D levels, their vitamin K, and discuss nutrition. Now I'm going to show you a little bit of literature on why asking about vitamin D levels, asking them about their vitamin regimen is really important. A lot of patients, you'll be surprised, they do not disclose what supplements they're taking. They're going to tell you, oh, we're not taking any medications. There can be all sorts of supplements, whether these supplements are helping or not. It's really, really important that we ask and dive deep into it, okay? Lack of vitamin D leads to caries, poor gut absorption, bleeding gums, bone resorption, loosening of teeth, and premature tooth loss. And I'm going to talk about again why asking about vitamin D3 and K2 is really important for orthodontic and airway treatment. Vitamin D3 deficiency reduces osseointegration and contributes to early implant failure, something that we really have to pay attention to. Any of your patients that you're doing expansion and they have implants. What's your plan with that? Now, to support proper vitamin D levels, we have to make sure the patient is adequately supplementing with vitamin K2. Vitamin K2, consider it the usher. It tells the calcium to go to the bone and teeth. Without vitamin K2, patients can end up getting calcium deposited in other areas that we don't want, like organs, arteries, and whatnot. So it's really, really important that we discuss the role of vitamin K2 in bone mineral regulation and transformation. Vitamin K2 is necessary for bone health and cardiovascular health. Again, lots and lots of literature on why we as dentists need to be aware of vitamin D3, and not just dentists, any health provider, anyone helping in that collaborative team needs to be following up with this. Vitamin D3 and magnesium supplementation for 8 weeks decreased anxiety and improved social conduct in children with ADHD. Sorry, I went the other way. Vitamin D and K led to significant improved bone mineral density. Lots and lots of research on this. Vitamin D3 and K2 improve bone mineralization. Now, my favorite vitamin K2 is this one from Claire Labs. I'm not affiliated with them. I just love that this is MK4. And that MK4 research has shown that it drives osteogenesis in the periodontal ligament and stem cells. MK4, it's a form of vitamin K2. It's attaches to a special switch in bone modeling cells. And when that switch is turned on, the cells increase the production of important proteins that help build and protect bone, like alkaline phosphatase, proteoglycerine, osteopontin, and matrix GLA protein. And these proteins strengthen the bone structure and support healthy bone formation. More research on the importance of vitamin K2. Highly recommend everybody kind of look into that and recommend it to your patients, especially anybody getting any kind of expansion. You want to make sure the patient is supported. They are able to produce more bone. Okay. Now, going back to the importance of vitamin D3 and K2 in orthodontics, why should everybody, involved, whether you have a patient that is going through ortho or not, you bring this to their attention. Again, there's lots of literature out there showing how it increases osteoblast, osteoclastic activity, improves bone health, and it actually reduces fractures in postmenopausal women. So every woman in premenopause or menopause or postmenopause should be very, very aware of her vitamin D levels and making sure she takes vitamin K2. So kind of wrapping up the vitamin D3 K2 conversation here. Vitamin D3 supports bone remodeling, foundation necessary for safe, effective tooth movement. Vitamin K2 ensures that calcium mobilized during remodeling is deposited in the jawbone and not in arteries, not in vessels, not in organs. And together they promote healthier bone metabolism, improve stability of orthodontic outcomes, and prevents potential relapse, especially in those patients that you see the periodontium is thinning as we're expanding. Just supplementation with vitamin D3, K2 could help support that. Now, magnesium. Why am I bringing magnesium up? Magnesium is so crucial for the enzymatic conversion of vitamin D3. So most of us are deficient in magnesium. We don't get enough magnesium in this day and age with the diets that we're exposed to. So ask your patient about magnesium. What kind of magnesium are they taking? And are they supplementing altogether or not? But all of these research articles show that higher magnesium intakes, it leads to better vitamin D levels. All right. Now, you your patient might come tell you, all right, so I checked, I did my blood work, my magnesium level is just fine. My doctor said I don't need to supplement. Now, the problem with that is they're only looking at 1% of your total body magnesium. 99% of the body magnesium is actually stored in cells and bones. So what we get on our CBC, our normal blood work, isn't a true representation of what's actually in your tissue. So you might look normal on a blood work, but you're deficient in the cellular magnesium, which is 99% of the magnesium in our body. Again, magnesium's role in the vitamin D3, calcium, and metabolism. It's a very, very important cofactor for the processing of vitamin D. And without enough magnesium, you could be taking all the vitamin D supplement you want, but it won't be effective. So low magnesium levels are linked with low vitamin D levels. So if you're taking vitamin D levels and if you're taking vitamin D and your levels are not, your blood work is not showing any improvement, you might want to look into your magnesium. Magnesium and calcium. Magnesium regulates the parathyroid hormone that balances the calcium. So low magnesium also causes cramps, bone loss, calcification in soft tissue. Adequate magnesium keeps the calcium in the bone and teeth. I've actually had one patient on a 3D scan. There was calcifications in the soft tissues. And I'm thinking, why could this be? Maybe that patient is very low in magnesium and they don't know. So the calcium is depositing in soft tissues versus the bone and teeth. There's a bunch of different types of magnesium. It's always kind of discussed that you want to alternate. My favorites are glycinate, threonate for brain and cognitive health, malate. You can alternate between the three. All right, now talking a little bit about shifting gears to why did I decide to incorporate cranial osteopathy or the concept of cranial osteopathy in dentistry. We are body, mind, and spirit, right? We can't just focus just on the mechanicals of the body without looking at the other two aspects of the human body. Once we shift gears and thinking, just utilizing our left brain, and looking into utilizing more of the right brain where you think in terms of energy, frequency, and vibration, you will unlock a whole paradigm of even connection with your patients because they can feel that energy. They can feel when you're, if you're frustrated with something and you don't even verbalize it, they can read your body language. So being in tune with energy of things, frequency, vibration of things can really, really transfer the way you practice, whether it's dentistry, body work, speech language pathology. So that was kind of the main reasons why I started going towards cranial osteopathy, because just the mechanical part theoretically didn't always achieve the results that I expected. It might have in one patient or a few patients, but not in every single patient. And I kind of questioned why. Well, if you're doing the same exact concept that you've been trained in, why are you not getting the same results? It's because, again, every human is different. And we'll talk a little bit more about that as we go. So cranial osteopathy and dentistry. This is my why. All right. So the cranium is very dynamic. Okay, we've been told that it's rigid, everything has fused, but that is really not the case. And again, as we go, I'll explain a little bit more why. Any kind of dental work a patient gets is going to affect their cranium. Why is it like, we work on one tooth and all of a sudden the patient's temporal bone hurts, or they have a frontal headache, their back hurts, because everything's interconnected. We are very, very dynamic human beings. We're not rigid. There is no way things are disfused. When we combine dentistry and osteopathic mindset, we will get better orthodontic and structural outcomes. So this is a quote by Dr. Andrew Taylor, still one of my favorites. The cerebral spinal fluid. We have to think to kind of understand how motion happens. We have to think about fluid, and the cerebrospinal fluid is the highest known element in the human body. He who is able to reason will see that this great river of life must be tapped and the withering field irrigated at once, or the harvest of health forever lost. Such a powerful quote. Again, shifting from left brain to right brain, this will make a lot more sense. Now, the CSF fluid in our body, it fluctuates, okay? It has a potency. It is called in the osteopathic world the breath of life. All life is manifested in energy or motion. Without motion, there's only death. So health is motion. We cannot achieve health without proper motion. And that's really, really, really important in any kind of work we do. So going back to a little bit of literature, where is this coming from? We're going to bring back the left side of the brain. The CSF, which is the cerebrospinal fluid motion in a healthy individual. So this is a research that was done showing that the cerebrospinal fluid doesn't just circulate in a unidirectional loop. It's actually from MRI studies and including quantitative and phase contrast imaging, they found that CSF doesn't flow like a river through the brain. It actually moves in multiple directions. It has a pulse to it. It's not a single continuous circulation. MRIs can show us that CSF motion in the order of centimeters per second. This study actually suggests reframing our understanding that CSF isn't circulating, rather it's pulsating. How amazing is that when you know, Dr. Still from another century talked about this, but now research is actually catching up and proving that the CSF does pulsate. There's life, there's motion in it. This is a sagittal view of the glymphatic system. This is how our brain detoxes from, you know, everything just processing information throughout the day. And this is where the sleep part comes in. It's really, really important. Not getting adequate deep sleep, we're not able to clear the lymphatic system only, the channels only open during deep sleep. And if we don't get proper drainage, there's no health. Patients start experiencing a lot of memory issues related to that. So CSF flows from the coronoid plexus into the subarachnoid spaces under the sagittal sinus. From there, it flows along the outside of the brain arteries into the interstitium, mixing with the interstitial fluid and clearing the toxins from the brain parenchyma. This is a very, very, very important process that our body does so brilliantly. We don't even think about it, but again, this is where the sleep, not getting good quality deep and REM sleep, affects our health. This is a science that proves that. This article here, which I found very, very, very interesting, was showing that improper lymph drainage in patients that struggle with chronic fatigue syndrome affected their cranial rhythm, that motion that we feel of the CSF. Cranial rhythmic impulse is proposed to arise from a combination of action of the CSF fluid draining from the brain and the spinal cord, and the sympathetically driven pulsation of the central lymphatic system. In patients that have chronic fatigue syndrome, the evidence suggests that they have a disrupted neurolymphatic rhythm. So they're not clearing the toxins out of their head properly. And that was very palpable in this study. Neurolymphatic disturbances are not only visible and palpable in chronic fatigue patients, but also this explains that this mechanism could explain a lot of other diseases. The author also showed that manual treatment protocols aimed at restoring proper cranial rhythmic impulse improve the lymphatic drainage, and it can help patients tremendously. That's why collaborating with craniosacral therapists, cranial osteopaths to help restore proper lymphatic drainage through the manipulation technique can truly, truly help your patients function better and be in better health. Another research from the University of Rochester, so cool. This is an artery in the brain of a mouse, and the green shows the cerebrospinal fluid channels along the outside of the artery. That was really cool. Again, CSF fluctuation and the lymphatic system. so important that this mechanism happens during deep sleep, and that we get good quality deep sleep in order to detox the brain. Now comes in the part of the muscle dysfunction. Other than swallow improves breathing, sleeping, muscle tone, from an osteopathic point of view, a functional swallow helps stimulate the cranium through the cruciate suture between the maxilla and the palatine bones, all the way to the SBS. It actually, and research has shown this, it actually helps detox the pituitary gland. So a functional swallow actually augments the motion of the venous system. So this is why we have to pay attention to cranial osteopathy and motion of the cranium, because it helps detox our brains. So going back to the concept of motion is health, we need to be aware and understand that we have, we need to support the patient to improve cranial motion because that improves the fluctuation of the CSF. Functional swallow and functional chewing contributes to motion in the cranium, leading to improved health. So we work a lot on the structure, okay? We get the structure better so the patient can breathe better, nasal breathing, posture, but we need to understand that the function is what creates the structure. Why do some people relapse and some people don't, whether they're using a retainer or not? Because we didn't pay attention to the function. If we have proper function, it's going to create the structure and support it. So again, we got to make sure the patient's cranial bones are healthy. There's proper motion and fluctuation of the CSF for things to hold. I really like this slide showing how many bones are in the orbits of our eye. There's 7 bones in the orbit of the eye. Why is this important when you're doing MARPE or expansion? Because we are moving the maxilla. Okay, the maxilla is the orange bone on this slide. What happens to the 6 other bones that are articulated? Do we pay attention to that? Have you asked your patients any visual changes? If any of your patients have visual changes, whether it's negative or positive, you really want to support them by making sure they are seeing a cranial osteopath or a craniosacral therapist to make sure things are moving, nothing's stuck, because when motion stops, health suffers. Okay. Now, I'm going to show a patient case, and the reason why I'm showing this patient is just, going back to this slide where look at the face, the bones of the face. If one of your patients gets into some kind of trauma or accident, it's not just where they hit the floor or the place of impact that's affected. It trickles a domino effect on a lot of other bones. So if we were hit on the side of the face, the cheek, and we got compression into the zygoma on one side, that will potentially decrease motion of the temporal bone. The orbit and even the palate may feel the inherent motion in the bones all the way to the toes. So that's why getting a really, really thorough history from your patient helps you understand why they present the way they present. So for instance, look at this patient. This is how she presented. This is what her cranium looked like. We measure asymmetries. When I see asymmetries, we measure them, kind of understand what happened. Why was growth kind of stunted on her right side? So this patient, when she was 5, she had an accident. She fell, hit the bumper of the car on her face on her right side. So that affected the articulation of the bones, and it stunted growth in her right condyle, and it created a lot of strain on her right side. Now, this patient didn't know back then what an osteopath is, what body work is, but it caused a lot of brain issues for her. She struggled with blurred vision, slurred speech, really poor breathing. Is this a patient we want to just jump on and start expanding? Yes, she does have airway issues, but should we start with that? Um, my goal for today's lecture is just to open your eye to see things. Just be aware of what the faces look. Look at her chin. It's deviated to the right. Look at her right eye. It's a little bit lower than the left. What happened as she was developing after that accent to the right side of her face? Why is the right side of her face stuck? If we start expanding her with whatever we do, we need to be aware that there's going to be more resistance on that side. How are we going to support this patient? Mind you, she has symptoms, TMJ symptoms, a lot of symptoms. Maybe we want to start with supporting her, her jaw, her TMJ, getting the temporal bones out of internal rotation. Things to just be aware of. More proof that our bones are not fused. Okay, cranial sutures contain stem cells. They remain biologically active throughout life, and this is research-based. Animal studies show measurable cranial bone motion in 200 to 300 micromillimeters in monkeys, cats, goats. Cranial bones shift after manipulation. Sutures are there. If you look at how intricate that sutures are, they're there to absorb. This is a protective mechanism in our body to absorb forces, to adapt to CSF changes and vascular pressure. Adult cranial bones are not fused solid. There's subtle motion capacity. More evidence, okay, because research is really, really important. These are multiple studies showing that radiographic and 3D kinematics found cranial bone motion in adults. Up to 91.6% of subjects showed measurable post-manipulation shifts across landmarks like the mastoid, the sphenoid, and the temporal region. Additional evidence includes rhythmical cranial diameter changes measured in real time, sometimes reported in aerospace physiology research. So the takeaway from those two studies is the anatomical view that cranial bones are permanently fused by adulthood is outdated. Okay, instead, cranial sutures remain biologically and mechanically functional, capable of subtle mobility under physiological conditions. More research. This study shows the relationship of mandibular deviation. What does it do to our cervical spine? What does it do to our neck? Mandibular deviation is associated with cervical spine postural deviation. Our occlusion is super related to C2. So any deviation in our occlusion and our bite is going to tremendously affect our cervical spine and hence affect the rest of the spine. So again, things to just be aware of and look out for. More research showing neck posture and jaw function in TMD. A systemic review involving 400 TMD patients found that abnormal head and neck posture affects jaw function, vice versa, reducing cervical range of motion and increased muscle trigger points. In summary, mandibular position influences neck posture, especially relevant in cases of asymmetry or TMD. Utilizing treatment options like soft tissue splints, soft tissue therapy splints can really improve neck range of motion. So being aware of how your patient's occlusion or their bite affects their cervical spine is so important. Patients ask me every day, what if I go get my neck adjusted? I'm like, that's wonderful. That's great. It's going to be very helpful. As soon as you walk out of that office and you clinch down, it's going to go back. And that's why you keep getting adjusted. Because again, your neck and your occlusion are so intricate and connected. All right, more research. Head and neck dysfunction, including flexion and structural compression, can obstruct lymphatic flow, increasing intracranial pressure and potentially impairing the lymphatic clearance. So bringing the awareness to start paying attention to cranial strains. What do cranial strains look like? We were going to discuss that in a minute, but understanding what cranial strains and lack of motion does to the overall wellness of the patient is really, really important. How it obstructs lymphatic flow, how it can increase intracranial pressure in the head, and how it can potentially impair lymphatic clearance. So again, CSF outflow via cranial lymphatics. Impairment in that drainage leads to increased intracranial pressure. Neck posture restriction affects clearance and lymphatic drainage. If we don't address what's happening with the bite and getting the neck in neutral and helping keeping it in neutral, we could affect the lymphatic drainage. Let's look at some of cranial strains. When you start looking at patients or anybody walking down the road, we are all asymmetrical human beings. Okay, we just need to understand that. But sometimes that asymmetry could be causing an issue with drainage and motion. So being aware of that and referring that patient, especially if they have symptoms that correlate to what you're seeing, and helping them get to the right provider is really, really, really crucial. Again, pay attention to what's happening with the face. Where are the eyes? The ears? Is one adducted, one abducted? Where's the chin deviated to? Tells you a lot about what's going on with the cranium. Now, going into the dental world, let's say this is one of your patients. Took a model, you're looking at the model, inspecting the model, and you draw the midline. And you notice that, for instance, the right side, it's a lot deeper than the left side. The left side's shallower and it's kind of extended out more. Why is that important to pay attention to? Because this patient has a cranial strain that has affected their growth. Now, let's say this patient has an airway problem and you're going to start expanding them or sending them to someone who's going to expand them, whether they are getting a MARPE or whatever they're getting. This patient needs to be supported by an osteopath. That right side of the maxilla is internally rotated. It's going to resist expansion. So what's going to happen is that left side that's externally rotated is going to compensate for that. So one side's going to go out quicker than the other. Now you just created a whole disruption in an already dysfunctional system. So if you don't get anything out of today's presentation, I really want you to just start observing and paying attention and help guide your patients. Now, this doesn't mean that those patients can't get expanded. They definitely can, but they need to be supported osteopathically, making sure nothing gets stuck, because again, motion is health. Let's look at a scan. Let's look at this palate. What's going on with this palate? Why is it canted like that? What does that mean? Maxilla, when it's canted like that, the sphenoid has an issue too. And what's happening with the occiput? If we don't pay attention to what the cranium's doing and we only focus on dental expansion, we're going to get potential issues. Ask your patients, are you getting headaches? Do you have pain? Is your TMJ flared up? That is your cue that this patient needs to see an osteopath or a craniosacral therapist or a body work specialist. Let's look at this patient. This is one of my patients. I didn't pay attention to the asymmetry that she had in the beginning, how her maxilla was very, very subtly canted. And she got a MARPE expansion. Now, if you pay attention to the midlines of the upper two front teeth and the bottom of the mandible, you will see the shift in the midline. But this patient wasn't supported with proper body work. And what happened is her left side, which was externally rotated side, it was a side that compensated, absorbed most of that expansion, and the right side didn't. So she ended up biting only on the right side second molars, and her TMJ flared up, having more issues, causing a lot of problems. So just want to make sure we are aware of seeing the signs, referring the patients to the proper provider, making sure they are supported cranially and the cranium and their body is ready for that kind of expansion. This is one of my patients who underwent expansion, MMA surgery. And even though her bones were chest plates in her cranium to hold everything, her head was still shifting. Her mandible kept rotating clockwise, aches and pains everywhere. How could this be when her bones are held with metal rods? Just again, opening your mind to things. Look at where her chin was. Look at her eyes in the beginning, and watch how it incrementally starts. Her whole head starts rotating clockwise very slowly. This is what she looked like before MMA, and then after MMA, and then the bottom picture was a few months ago at my office. Even though the structure was brought to optimum, because of functional issues, the function controls the structure. That's why things don't hold. Again, this is a progression of the can't. As things progressed, what happened to the maxilla? Okay, this is post MMA surgery. So why am I showing all this? So that you understand that we gotta look at the fascia, we gotta look at the function, we gotta pay attention to the cranial strains, because if we don't, things are not going to hold. Our work will not hold. I want to show a few cases and kind of what to also look for before we send patients to other providers. This patient came in because she was wanting a provider who does night lace for snoring. So we did the full workup for her. Immediately, just looking at her picture, I could see her cervical spine is deviated to the right excessively. Her head's tilted to the left. Her body's trying to stabilize her. I don't even know what's happening with her thoracic and her thoracic spine, but it's all interconnected. Okay. Now, before let me show you what the cervical spine looks like from behind. This is what her neck is. This someone that you would go and expand with a neck like that, even though she came to you for sleep and airway? I just want you to, assess and stop for a second and really try to help the patients be well before we start addressing things that we think should be priority. Okay. Now, we can't deny that she has an airway problem. Okay. But her body is just so dysregulated. And you can tell from just her eyes. And of course, we have asymmetry. Now, I wanted to test for myself how, if we get her neck in neutral and get her a bite when her neck in neutral, how that's going to affect her overall posture, autonomic nervous system, and breathing. So I got her neck in neutral. I put bite registration material in her mouth, and I had her get up and walk. And immediately her range of motion in her neck improved. She was able to move her neck right and left so much easier. When I did the gait analysis, her stride got significantly better. Her eyes opened up. Her whole well-being just totally shifted. This is what she came in, what she looked like. And this is a few minutes later when I got her neck in neutral and I gave her a bite in that position. Her neck straightened up, her eyes opened up, her head straightened up. This is the power of the occlusion and what it can do to the cervical spine, to your overall gait. Okay, she didn't get anything. The only difference between this picture is a couple minutes. Again, look at her eyes, look at her head. Just mind-blowing. So going back to the goal of the lecture today, if you just get one thing out of this, and just paying more attention to those asymmetry. What's the neck doing? What's the story there? Asking more questions. Does this patient have an airway issue? Absolutely. But is she stable enough to get expansion? In my office, I don't think so. She needs to spend some time in stabilization phase while working with body work specialists, myofunctional therapists. And once her body is more in neutral, and her cranium is in neutral, that's when she would be ready for expansion. Let's look at more asymmetries. This patient was referred to me by an acupuncturist, severe TMD problems all her life, ear pain, jaw pain. She's seen all sorts of people, multiple autoimmune issues. She got Botox for her TMJ, nothing really helped, okay? Look at that maxillary plane. Look at that. Okay, you could see it on her face. So this is what we do in our office. We take photos, we take posture photos and the CBCT, and I open both of them in my screens, and I look. Are the orbital levels the same on the CBCT as what I see on the face? I turn the cranium around and I look at, the back pictures, and also what do I see from looking from behind? And it just gives me a whole story on what this patient has endured. Now let's look at the measurement. Look at this. Look at the difference in the length of the body of the mandible and the condyles. So this patient is living with chronic asymmetry, asymmetrical muscle pull, asymmetrical cranial motion, cranial strains. That's why nothing is really working for her. Her body needs harmony. Her body needed to get into some sort of neutral. Again, looking at the pictures, what does the palette tell you? What's going on there? Look at the left side and the right side. The left side's internally rotated. How do I know? Right here, it's internally rotated, very steep angle. The right side's externally rotated. She has very reduced vertical dimension. So we got her first. We were going to focus on stabilization, stabilized her condyles, brought her back cranial motion. She had no cranial motion on her left side. Worked with other specialists to collaborate with her work. And this is what we were able to achieve in 1 year. I will say 95% of her symptoms just kind of went away. You can see in this picture, her face is like her body is under a lot of stress. Where the picture on the green, she looks a little bit more neutralized. CBCT changes that we observed in a couple years. There's more harmony, there's more balance. Okay. What I did for her, we did a lot of cranial releases. We did photobiomodulation for a TMD. We did prolotherapy injections until her symptoms were so much better. And I will say 90% better. And then we started her in clear aligners to balance the bite. This is a little video of her kind of, no, I don't know if it's going to.
Oh, we
Think
can't hear
volume.
her.
Okay.
No, it is
She
not
did,
playing.
let me, uh, here we go. Maybe I think it's good.
Let's see. But it's skipping. We can barely tell what she's saying.
You can't hear?
No, is it because it's playing and you have your microphone here?
Maybe I did change it to
As soon as you share your slides,
Got it.
something on the right side that says, please share audio too. When you first share it, you have to kind of click that button most times
Okay. Let me
for it to play with.
share again.
By the way, I am just going to go ahead and say it. It is one of my favorite Thursday Night Lives.
Oh, yay!
I am in awe. I'm literally scheduling my plane ticket from Wisconsin.
You're so sweet. I'm telling you, this is my passion. This is why I wake up every morning. I feel like we can do so much better. We can really help our patients on so many levels if we just get out of the I'm here to fix. We're here to
Mhm.
support. We're here to support. The body is incredibly intelligent and self-regulating. We
Yeah.
need to support it to get there. It can fix itself. We just have to remove the barriers. So that's my goal, is just to remove the barriers, you know? Um,
Thank you. Keep going.
okay.
Let's see if it's gonna play now.
Is that better?
So I found Dr. Oushy about 6 months ago, and prior to
Can you hear it better?
Sorry, I thought you saw me. Yes. And it
Okay.
comes up.
No.
so I found Dr. Oushy about 6 months ago, and prior to that, I had been going to an oral surgeon for some severe TMJ pain, and his approach was to give me Botox injections and steroid injections, have me take some antidepressants, and to eat a very soft diet.
And did you get the Botox?
And I did end up getting the Botox injections.
And how did that help?
They were supposed to kick in 3 weeks after the injections, and about 3 weeks after the injections, I had the most severe pain I've ever had in my life. Almost went to the ER because the pain in my jaw and head was so severe. So I realized that wasn't going to be the answer to fix it.
What kind of pain were you living with, Sherry?
I had been living with this chronic pain, lots and lots of headaches, and it began several years ago, pain down my neck, left side. So I went to an orthopedic surgeon to see what was causing that, because I wasn't necessarily connecting it. Then it began to be shoulder pain, neck pain, shoulder pain, and then I began to have hip pain. Like, it just started moving down my body, and I never connected it until I found Dr. Oushy, and she started me with an upper orthotic to untrap the jaw. She gave me some Prolo injections for the jaw on each side. And just after the first day I spent with her, the pain was less than it had been in years of my life. Like, it was unbelievable. So I came and saw her every week. We adjusted the orthotic. She did the myofascial releases for me. I would walk out of her office feeling so much better and pain-free than I'd felt in years. And so that's been—
How are your headaches now and your pain?
I do not even have headaches anymore. Like, the headaches are so rare and so mild. It's just life-changing. I don't remember when I was this pain-free, right? And it changes your whole life, because chronic pain is debilitating to every part of your life. And so it's been really life-changing.
Thank you, Sherry. Appreciate it.
So this is her candid plan. I'm actually working with a periodontist who did kind of a mini SFOT for her, because the buccal bone was kind of, thin. She had some dehiscence and fenestrations, and that worked out beautifully because we were able to utilize her clear aligners to give her what she needed. Another case, we're going to go through these a little quicker because we're kind of running out of time. This patient came in, clinching, grinding, breaking teeth, crowns popping off, and I told her what I see. I told her the red flags that I saw. And at first she kind of was in denial and didn't really think that was, an issue, but we put her in a TMD orthotic, got her balanced and neutral, and then we went to clear aligners. So look at her posture in green. See how she was swaying forward? This patient did not have proper grounding through her bite, okay? Picture on the right is after. She's so more in her body. She's so more present. This is what her bite looked like in the beginning. Just trapped mandible, you know, incisor, anterior edge to edge. Cranial strains happening. You know, I like to look at what's happening with the palate. Why is one side higher than the other? She's trapped. Of course, mandibular tori going on. And this is what we were able to achieve with the orthotic treatment, stabilization, and then clear aligners. The change is very subtle, but I was trying to upload her video, but it was a little long, and she was saying she's not snoring anymore. Her bite for the first time in her life feels like a easy bite. This is what her treatment kind of looked like. And then I want to share with you guys my case. So I was a victim of upper bicuspid extraction. I was in a bilateral posterior crossbite, trapped mandible, the whole shebang. And I did actually treat myself. And over years, I'm still in in the process, but I did not get a MARPE. I utilized osteopathic concepts, including Wolff's Law, which we'll touch about in a minute. That cyclical forces and how it stimulates osteoblasts and how it stimulates bone remodeling in my favor. This is what my maxilla looked like before. Very trapped, very heavy anterior bite because my mandible was super trapped. I was able to open up my extraction space and kind of almost double my airway. This is what my airway looked like before, and on the right is after. So I think I went from a minimal cross section of 144 to like 303. My sleep improved drastically. Now, look at my cranial strains. Okay, my maxilla was super canted. My sphenoid was canted as well. My mandible was deviated. And when you respect the cranium and when you respect these concepts, you can soften things and improve function. Again, remember, motion is health and function creates the structure. So if you respect the cranium, if you respect what the body is trying to tell you, only great things will happen. So very briefly and quickly, these are the main categories of cranial strains. There are physiological strains, there's non-physiological strains. So physiological strains are normal variation of motion, and they're usually around a main axis. They reflect adaptation within the range of cranial motion. Non-physiological strains occur when the bones get locked or displaced. And you could definitely read the book, Osteopathy in the Cranial Field by Dr. Magoon. So much information there. Just explaining the different, so cranial strains are very complicated, but just understanding when to know there's a definite cranial strain that will compromise your expansion or whatever treatment, that's a goal. That's a goal for you today, is just to understand when you see a cranial strain or when you see something off versus this patient is okay. But working with a osteopath, a cranial osteopath or a CFT will help guide you in when this patient ready or not. I mentioned Wolff's Law, okay? Cyclical forces. Wolff's Law, bone adapts when force is placed on it. Increased stress load, bone deposition, decreased stress load, bone resorption, sorry, the vice versa. So understanding this law, understanding the physics of it and how to incorporate it osteopathically can really change things in the orthodontic world. Braces, aligners, you can get those, you can utilize Wolff's Law and get the cyclical forces benefit in bone remodeling. Orthodontic forces don't just move teeth, they should remodel bone and sutures. enabling stable expansion, remodeling, and even airway improvement. If we just apply force that's constant, we get bone loss. We get teeth coming out of the bone. If you utilize, aware of Wolff's Law and utilize cyclical on and off forces, then you're working at an epigenetic level. You are stimulating osteoblasts at a very, very different level, and you can let the body do what it needs to do. Utilize that inherent intelligence in the human body to get to the goal that you need. Again, little explanation of cyclical forces, because bone cells, they are mechanosensors. They respond best to cyclical forces, so repeated rhythmic loading rather than constant loading. This is all research based. Static continuous force leads to bone resorption only. You want that cyclical strain because fluid movement in tiny channels in the osteocytes only happens when you sustain the cyclical force. That shear stress activates the signaling molecules like the prostaglandins and nitric oxide. Now, combine that with paying attention to the vitamin D3, K2, and magnesium, and watch the body do amazing things. So this is what epigenetics means. This is what turning on that switch, supporting the osteoblastic, osteoclastic activity. Braces and clear aligners, they could do that as well. MARPE, if done correctly, respecting those two concepts, anything will go well. It doesn't even matter what appliance you use. It really doesn't, as long as you respect those two concepts. This is the patient. We did phase 1 expansion. Paying attention to these two concepts and paying attention to the strains. Look what happened to the posture after a year and a half. And mind you, I wanted them to go see an osteopath, myofunctional therapy. Not everybody does everything I recommend. They are about to start myofunctional therapy, but this is the result of just phase 1 expansion when these concepts are taken into consideration. This little girl, she definitely needs expansion. Her transmolar width was like, I don't know, 28, something like that. But is this someone you just want to put an RPE in? What's going on with her head? What's going on with her left ear? What's going on with her left eye? If we just go ahead and put a regular expander in this girl, the side that's externally rotated is going to expand and the other side is not. And she's going to develop more strains. We're going to make her cranial strains worse. So she got a different approach. We used a different appliance with her. But again, it doesn't even matter the appliance you're using as long as you respect the cranium, you respect the function, you respect the strain and address it. Look at what happened to her face as we progressed. Okay, I'm not out to fix asymmetry because again, we are all humans and we are perfectly imperfect, but we want to optimize the body. We want to optimize the body and get it to where it self-supports. Okay, so from where we started to where we're at, we didn't make her worse. We didn't make her asymmetry worse. We actually improved it a little bit. Look what happened with the posture. I love this picture from the back because it tells you what the neck's doing. Okay, we don't tell them how to stand. We just tell them to stand and look straight. But you will get so much information just by observing the posture photos. They say a whole story. Another case, just going through cases pretty quickly. Look at my favorite picture right here. Look at what's happening with the maxilla. Okay, are the right and left side growing, expanding at the same? I mean, looking the same? I don't think so. The right side is more out, it's more externally rotated than the left. Again, not seeing that and not paying attention to it and not letting the other providers collaborating with you know this could be an issue. Okay, after phase 1, we want to optimize things. So in our office, we do a lot of palpation. Now, if you're not trained in any kind of cranial osteopathy, definitely work with an osteopath. It would be amazing if you can have an osteopath or a CFT work with you in the office to help guide you on the best way to support the body. this is kind of the basic way I can sense what's happening with the cranial rhythm, what's happening in the cranium. Are there strains? Are there not? There's many, this is the basic hold of just how to get a gauge or sense the cranium. But I highly, highly encourage you to get some training on this. Go to your local osteopath or your local CST and understand this, because once you see it, you can't unsee it. Work with other specialists, collaborate. You cannot do this alone. You will only get best results that are sustainable once you collaborate. This is what collaboration looks like. I go to California once a month and I collaborate with a myofunctional therapist, a podiatrist, a chiropractor, an osteopath, and we assess the patient from head to toe. I learn so much so I can help my patients better. We see what's happening. They tell me what's happening with the pelvic the pelvis, what's happening with the thoracic cavity, thoracic chest, and it helps me understand what I need to do, and we can right there real time adjust things to optimize function, optimize motion. This is a picture of us working on a patient together. And then final thoughts. We are imperfectly perfect human beings, and perfection as a human is not easy. And I just want you to focus on the concept that we're trying to find health. Anybody can find disease. If you look at anybody, they are, we are trained in this day and age to diagnose and treatment plan, but we need to find health. We need to respect the body and understand that it's capable of self-healing, self-regulating, and maintaining. We have to find health and remove barriers so the body can actually do that. Once we believe in that concept, a lot of things will change for us. The body is one unit. We cannot separate mind, body, and spirit. We gotta get a little bit out of our left brain and let the right brain flourish and utilize both in your judgment. You want to be there to support your patient. You don't want to be there to fix. That mindset really needs to change. We have to let the physiology function to express its own unerring potential rather than apply blind forces. And I will end with this statement for Dr. Sutherland. Our bodies are just amazing.
I don't think anybody has ever left me speechless. What is the closest airport to you? That's my first question.
El Paso Airport.
Thank you very much. I'm looking at flights today. This is insane. It was a speech pathologist that said, you guys need to interview her. She is incredible. Let me see her. Oh, Biohacker SOP was the one that sent me a message and said, you don't understand, you need to have her on. So I'm so glad that you agreed to be here with us for this whole hour. I know that you have patients coming up. How much?
Yes, they're probably going to call me in a minute. I think someone was asking about the book.
Yes.
This is the book. I will write in the chat. Osteopathy in the Cranial Field. Getting whatever field you're in, getting some course or lecture, even read this book could be a little intimidating to read. So I would encourage you to not, if this is your first experience in any kind of cranial osteopathic work, leave this for a little bit. Take a simpler course. And actually, I'm in the process of collaborating with Dr. Charles Beck.
Oh, amazing.
Amazing osteopath.
He's spoken for us before.
We are going to plan together an introductory cranial course, and I am so excited. We're going to co-teach it. I'm so excited about it. So that's kind of, I'm just putting it out there. That's, in the works, but Upledger Institute, the Cranial Academy has a lot of courses. Just even if you're not going to do it, if your license doesn't let you do it, once you understand it, you're going to look at things so differently. You can't unsee it when you see it. You just can't.
I know. It is incredible. I mean, the changes in in symmetry just by stabilizing the cranium and giving the occlusion what it needs and the changes in the body, that just blew my mind. So I have a couple questions if we have
Yes.
a couple minutes. One, how significant is it to get a CBCT before palatal expansion?
Extremely significant. It tells you so much information. And I know I mentioned this in my lecture. I send every and I don't understand, with all due respect to all the specialists out there, if you're taking a big field of view CBCT, how they're not sending it to be read by a oral maxillofacial radiologist. In our day-to-day lives, we don't have time or the training to go through I've seen things that he's written down in the cranium. He sent me messages like, send this patient right now to get a skull-based MRI.
Wow.
Because I see something that's really concerning. And my brother, who's a neurosurgeon, when I first got my CBCT machine, he told me, make sure you send every scan to be read. And that was the day I kind of like, so my recommendation to anybody who has a CBCT machine, make sure you're sending it to be read by a board certified oral maxillofacial radiologist. And yes, absolutely, because I get so much information. I can see what's happening with the adenoids. I can see what's happening with the tonsils. And then I have a report that I could print out, give to my patient to take to the ENT, because if they go to the ENT and tell them, oh, my dentist said this, that doesn't really go.
Exactly.
But if I have a report that's printed from a board certified oral maxillofacial radiologist saying the classification of the adenoids, and he suggests ENT consultation for possible adenodectomy or tonsillectomy, it makes them more legit. It makes them really take, and I only send the patients that have like a grade 4 or really bad grade 3. Grade 2s, even grade 3, if the parents are committed. I've seen one parent actually, he took it upon himself to do all the research. He changed so much in the girl's life. Her adenoids were grade 3, tonsils were grade 2. And after 6 months, he came back. He's like, hey, can I just retake the CBCT? I just want to see, everything that we did. And he was able to shrink them. They went down to like almost a grade 1. But he took it, but not every parent, can commit to that. And I tell them, I'm with you. I'm not for surgery. If you're going to commit to help reduce inflammation, we could do it.
So that's
but
diet, dairy,
diet,
fruits,
toxins, environmental toxins, mold. You will be surprised at how many people don't think they have mold, and there's mold. Check your washing machine, check your bathrooms. But the thing is, not everyone's affected the same. A parent might be just fine and their child has gene mutations, and their chelation process isn't up to par. So they're reacting a ton more than someone who doesn't. So when you see one kid, their sinuses are completely blocked out, their maxillary sinus, you got to check for mold.
Wow.
Even if the parent tells you, oh, no, we're fine. Yeah, you're fine. You're lucky. You got very fortunate with good genes. Maybe your child has more mutation than you. Look into that.
I heard that in a household of 4 people, one person will get really sick. And mold is everywhere. We do get
everywhere.
Mold. However, some people are going to react way differently. I have a patient that recently, lives in a very nice, beautiful, huge home. They just purchased and built the home new. And all of a sudden, his breathing started getting worse after being in the home for about a month. Wow. And they went to see in the ice maker, to have a special ice maker, had mold growing in it already.
So that's the thing we just need to pay attention to. Like all my patients, I do a Zoom call with them after the records, and I go over these things. I'm like, you got to look deeper. If you're doing all the things, if you're eating a really clean diet, there's something. The body's not just crazy. It's reacting to something. Our bodies are incredibly intelligent. They're giving you messages every day. You just have to be open to it. That's it.
And just to let you guys know, by the time that this plays, Airway Circle is working with beam readers to have our own protocol. So whenever you guys send a scan to beam readers, you can say, I would like to get the Airway Circle protocol. I cannot wait to be able to share with you guys the things that we like to see every time that a scan is sent in. And if you have any recommendations, please message me and I'll make sure to get that in there. Let's see another question. Can you talk just a little bit about the difference between cranial osteopath and craniosacral therapy?
And I will quote Dr. Beck my mentor, because he explained this a little bit. And with all due respect to craniosacral therapists out there, I think you guys are amazing. The depth, so basically imagine a river with a ton of logs, okay? CST will go in there, move a few logs so the traffic keeps moving. Okay, so they shift things around the main problem. So things move, great, beautiful. Osteopaths come in there and just like, boom, it's gone. That's the main difference. But also, not every osteopath is the same and not every CST is the same. There are craniosacral
Yeah.
therapists that are amazing. They've
Mhm.
went above and beyond the basic requirements for their knowledge. And there are some osteopaths that have not done any cranial. So like for instance, the cranial releases that I do, I have people come tell me, oh, the osteopath, they don't do it the way you do. They don't get inside the mouth the way you do. And all due respect to that, you just have to make sure they have some kind of cranial training.
Mhm.
A lot of cranial training would be best, but if you can't, they need some kind of cranial training
Yeah.
because the cranium has 22 bones.
Wow.
The
And
orbit itself has 7. So and the like, if you see the palatine bone, I've held a real palatine bone in my hand. It's like a wafer.
wow.
Like, it's so delicate. And once you feel it, you're like, wow. So we gotta be cautious with those things. We gotta respect the body at another level.
100%. And I love that you brought the three were body, spiritual, and soul, whatever else we said there, but there are three.
The mind, body, and spirit.
Mind, body, and spirit. It's so important for us to look at all those. I have had a couple different craniosacral therapists work on me, and it's crazy how different one can be from the other. And there's one specific that works on me that she is so heavy. She
Wow.
has such heavy energy, and I wonder how much that affects their patients, how much it
Oh
triggers
my
them.
God. I want to tell you, I have some patients that come because they're so connected to they love my energy, and I'm really aware of people's energy. I would encourage anybody to take some kind of energy healing courses. I've taken tuning fork courses. I do singing. I'm like a certified sound here. I do sound, but I do it just for my family. I do singing bowls. I mean, the more you dive into this, the more you are in tune with your patient's energy, the more grounded you are. So you go in there really grounded. We utilize flower essences in our office. Lotus Way is one of my favorite ones. So we do flower tests. I ask my patients, like, what's burdening you right now? Imagine how you would feel if it's lifted away. And I show them visual pictures of flowers and have them pick the one that attracts them. And on a kinesiological level, what they pick is really what they need. And once I kind of spray the mist of flower essence, their whole demeanor just changes. Like their
Wow.
whole energy just changes. So I'm going to spray one that's called Wild Abundance. And this is kind of for everybody in the audience because this is for prosperity, a divine beauty, magic in everyday life. It works on a energetic level. People feel it. So being in tune like that and working on you as a human is only going to help your patients. If you incorporate more of the right brain, only great things will happen.
Oh my gosh, I know you have to go. Last question so we can
Yes, tell me.
like this. Cranial strains and expansion. What is the process like whenever you're working with somebody who has all these cranial strains? What should somebody expect in terms of how long is a treatment? What kind of appliances? I know that everybody's different, but do you have like a general idea of how long?
So, and I learned this from trial and error, okay? Because my patients teach me every day. And every course that I've taken, because I've taken so many courses, it didn't sit well with me that this is the same thing for every patient. Okay. You have to have tools in your toolbox for every situation. A kid comes in and you take profile pictures and you look at them. You get a posture zone thing. Look at their shoulder. Are their shoulders way off? Are their eyes way off? Are their ears way off? If you find a kid like that, then stop for a moment. Yes, you saw their CBCT, they have all the things, okay? You send that kid to an osteopath. I've had kids with all these issues and they come in the office and they're just bouncing on the wall or they have severe anxiety. There's so much autonomic dysregulation with these kids because when you have cranial strain, the vagus nerves runs in the jugular, near the jugular foramen through bones. If you look at real bones and see the opening of those nerves and imagine bones getting stuck, no motion, what's going to happen to the nerves? Okay. You see all the autonomic dysregulation. Is this a kid you want to jump into expansion? No. So for instance, that girl I showed you guys with the asymmetries, I learned the hard way. You know, another girl before her, I started expanding her, and I because I take pictures every time they come in, and I put them in folders, and I look. I noticed her asymmetry was getting worse, so I stopped. I took her appliance out. I went and learned about the ALF appliance, and I put her in an ALF. And I started learning how to palpate, and I started supporting her cranium with the osteopath. Once you again remove the barriers, and then the body is going to, oh, hey. So that's how I gauge it, whether this kid can, some kids don't have significant asymmetry, and they need a lot of expansion, so I have to go with something a little bit more robust. Doesn't matter the appliance, it's the thought process. It's a proper assessment of the whole body. Okay, getting an assessment from an osteopath, tell them, hey, what's happening with the cranium? Is there something that I should pay attention to? They'll tell you, oh yeah, the left side temporal bone is really stuck. Okay, you got to go with something that's a little bit more fluid, a little softer, that will respect that. Maybe get them regulated first for a longer period of time before you start expansion. So it's kind of like a balance. It's a dance. You got to have all the tools in learn about all the appliances, have referral sources in your area to help you and support you. Don't do it alone. There's no reason to. But that's how I do it in my office. The pictures, the CT scan, the radiology report, and I sit in the morning because I'm a morning person, an hour before I do my Zoom call, and I assess everything. And getting some muscle testing involved won't hurt at all, you know? Using the intelligence of the body to help guide you. But you got to use your left brain and you got to use your right brain. You just have to find a balance.
I love it. Seriously, one of my favorite TNLs ever. Thank you so much for being here.
You are so welcome.
I seriously want to come see you, so I'll message you later.
Thank you for having me. It's been such a pleasure.
Thank you, guys. Happy Friday, everyone. We'll see you next week.
Have a great day. Bye.
Bye. Thank you.